Welcome AP Stats. We are going to talk about now how we look at experiments and actually carrying those out. There's different types of experiments that we're going to run. And so we're going to start looking at some vocabulary dealing with experiments. Okay. So first off, experiment, you deliberately impose some treatment on individuals in order to observe their response. Versus an observational study, you observe individuals and measure variables of interest, but do not attempt to influence the responses. So in an observational study, you're just watching what's happening. You have no control over what people are doing. Versus an experiment, you're putting them into treatment groups and actually applying some sort of treatment to them. Experimental units are the individuals on which the experiment is done. So sometimes it's people, sometimes you're separating people out, sometimes it's animals, sometimes it's whatever you're looking into to study. That's the experimental units. The subjects, that's when the experimental units are humans, is what we call them subjects. Sometimes they're not, and sometimes they are. So, right, they're called subjects. A treatment is a specific experimental condition applied to the units. Factors. Explanatory variables in an experiment are sometimes given at different levels. So, if we wanted to test like the effect of calcium on blood pressure, something like that, you could give calcium at a low level and then a high level and see if that is affecting things. So the factors are just the different levels of what we're giving in the experiment. A control group is a group of patients who receive a sham treatment. So usually they're receiving something, so they think that they're part of a study, but that has no medication in it or nothing that's actually going to help them to change what you're looking into. So the placebo effect is a dummy or sham treatment that can have no physical effect. So a lot of times, like in the last example I just said of looking at calcium, the effect of calcium on, say, blood pressure, you could do 2 different levels of calcium, like a high and a low, and then the third group would also be like a control group where there's actually no calcium in their pill at all. It's basically a sugar pill, and that's what the placebo is. There's no active medication in it, but they're taking a pill thinking that they're part of the study. And so it really has no effect on their body, but sometimes people think it has an effect on their body. And so the mind is a very powerful tool in healing and thinking that you're getting better and making you feel like you're getting better, or in this case, reducing your blood pressure or something like that. And actually, doctors have been surveyed to see how many overall in the sample that they took have prescribed a placebo effect or a placebo pill, which basically means there's no medication in it at all. And I forget the exact value, but it's something in like the 80%. So majority of doctors have at one time or another basically given people a prescription for a pill that does nothing for them. Okay? And so that, again, is because basically your mind is a powerful tool. You go to the doctor thinking you need a pill to get better for whatever you go there for. You need some medication to get better, and so the doctor will give you that so that you feel fulfilled in going to the doctor and seeking out help, but really it's doing nothing for you. So yes, you have, not necessarily you, but in general, people have filled prescriptions for placebo pills. So just a side note. Statistically significant is an observed effect so large that it would rarely occur by chance. Okay, so we're seeing that the medication significantly helped. So statistically significant is a particular cutoff value where we're going to say this couldn't have happened by chance. It's happened because the medication has been effective. And we'll talk about this pretty much all next semester of what we're going to consider statistically significant. We'll have a cutoff value. Here we're just looking at how to design the experiment, not actually testing it to see if it is statistically significant. And then confounded. This is effects of 2 variables on a response variable cannot be distinguished from each other. Confounded variables can be either explanatory or response variables. And we'll look at this in a second. At the bottom of the page, there's a couple examples between confounded and lurking variables. And that's one thing that we are going to have to be able to tell the difference between. And so we'll talk about that again in just a minute. Okay, so the main difference, and you'll have examples where you're going to have to figure out if things are observational studies or controlled experiments. Okay, so here in the middle of the page, an observational study, the researcher has no power over assignment into treatment and control groups. Okay, subjects themselves, or simply fate, determine who gets the treatment and who doesn't. Researcher just observes what happens. Okay, so either you're just watching and taking note of, I don't know, how many people wash their hands, or something like that, versus actually having control over it, or just going back and looking at records to see, like if I went back and looked at attendance records and looked at the number of absences and how that correlated with your grade. I'm not actually influencing you to be in class. I'm just going back and looking at what students have chosen to do, if they were present or not in class, and then that may affect their grade. And so I'm just going back and looking at records. That would be observational. Okay, so control experiment, where a researcher decides how to divide the subjects into treatment and control groups. Subjects may be randomly assigned to treatment and control, and subjects may be non-randomly assigned to treatment and control. Most of the time, we try to randomly assign them. That's the best way to conduct an experiment, and usually the best thing that we always want to do is use randomization. So usually you're going to randomly assign someone to a treatment and control. All right, observational studies are done out of necessity. Whenever possible, it's better to do a controlled experiment. Okay, so this is ideal. You always want to try to do an experiment if you can. The main problem of observational studies is that we can show association, but it's very difficult to show causation. And that's really the whole goal, usually, is to show causation. Sometimes the response can be caused by a third confounding factor. Or fourth or fifth. There could be other variables involved. So again, the whole point of usually conducting an experiment, like to show that calcium lowers blood pressure, is to show that there's a cause there, cause and effect relationship, not just that there's an association. Usually we want to try to show a cause. Right, so on that last bullet where you said observational studies are usually done out of necessity, it's because you usually can't run an experiment on something that's unethical, okay, or something that's going to possibly harm the individual. But we usually we need to have data revolving around certain things. I'll give you a couple examples right here. So, examples for why we have to do observational studies. If we want to look at the effects of a couple of things, like malnutrition. Okay, unfortunately, that just happens around the world, where people are not getting enough to eat, and how that affects your body. There, we can't actually conduct an experiment or whatever want to where you're not giving a certain group of people food. That's just unethical, inappropriate to do. But we do need to see what happens when people are without food, and so you can do an observational study on that where it's just happening around the world, and you're taking information from what is happening just by that being part of their daily life. Same thing, we kind of talked about smoking before, where it's unethical to do an experiment revolving smoking and lung cancer. Okay, so the effects of smoking And lung cancer, you can't do an experiment where you make certain number of people smoke certain number of packs a day and show that smoking causes lung cancer. Okay, you can't do that. So it's an observational study. So that's why it's very hard to show that smoking causes lung cancer. We can only show that there's an association, and that's why on the labels of cigarettes it says warning, it may cause lung cancer, because you can't actually prove it because you can't do the study to prove it. So it's kind of like a big circle. And there's all sorts of other things that are, kind of morbid and not really nice to think about, but we um, care to know the results, but we can't actually conduct experiments. Another one would be like alcohol on fetal development. Or drug use, all of those kind of categories. So fetal development, so for a woman who's pregnant, you're not going to go and run an experiment and see what happens when a pregnant woman, uh, you know, takes in alcohol or drugs or any of those kind of things, but we have to have warnings and kind of look into the data of the results of what happens so that we can deter people from doing that. And so again, that would be something that you would just observe that naturally happens in our world, unfortunately, but we're not going to run an experiment on it. So something that's not so sad. Another thing, kind of topic that is just observational, would be something like birth order and academic achievement. Like, is the firstborn in the family? Sorry, this is messy. Academic achievement. So is the older sibling usually tend to be achieve more academics, or how does the middle child syndrome play into these things? So this isn't something you can do an experiment on. You're just observing histories and records and looking back over things.